From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. When it comes to refreshing your look, sometimes the smallest tweaks make the biggest impact, especially when it comes to the lips. From a subtle lift to a little extra shape or softening those fine lines around the mouth, there are plenty of ways to enhance this area. Yes, we're talking lip lifts, flips, fillers, and Botox. Today, we're joined by Dr. Yula Indeyeva, a double board-certified facial plastic and reconstructive surgeon, fellowship-trained in face and neck lifts, and the founder of Facial Plastic Surgery of Austin in Austin, Texas. So if you've ever wondered which option might be right for you or how they can all work together to help enhance your natural features, you're in the right place. Let's get into it. Dr. Indeyeva, welcome to the Care Experts podcast. We're so thrilled to have you here today.
I'm so happy to be here. Thanks for having me.
Let's talk about lips. I feel like when it comes to cosmetics, aesthetics, surgeries right now, everyone is talking about the lips. Obviously, it's a very visible part of our face. I would love it if you could explain to us what a lip lift is.
Yes. So let's review some basic anatomy to start. So a lip lift addresses the upper lip. It's a surgical procedure designed to shorten and make the pink lip more established. There's two basic parts to the upper lip. The white cutaneous means skin, the white upper lip, and the pink upper lip. And these are important when we talk about lip lifts because a lip lift involves trimming a small portion of the white part of the upper lip in order to restore the height of the pink upper lip.
Amazing. So if anyone's listening right now and you're not watching along on our YouTube channel, when she's referring to the white lip, it's the area between the top of the upper lip and the nose, the bottom of the nose. Okay,
yes.
Great.
And the pink lip is literally the lip we typically think about as the lip, which is the pink lip. And then a couple of other relevant terms are the border of the pink lip is the vermilion border.
Okay.
And in this kind of the center of the upper lip is what's called a Cupid's bow, which is right in the middle. There's a little valley between two hills. And it's this architecture that really signifies kind of the youthful lip and what typically appears attractive to us is having that distinction between the central dip and two columns surrounding that.
Okay, amazing. Are people who are coming in for a lip lift often doing it at the same time as a neck or facelift, or is it a completely separate procedure that people do?
It can be a separate procedure. I would say most of my patients like the one and done approach, so they often do that in conjunction with a full facial rejuvenation.
Would you say with the lip lift, though, that it can be done without doing the full treatment?
Can. Correct.
Okay.
It can be done. It can be done under local anesthesia without even going into, we can do this with patients awake and alert and just completely numb.
Are most people doing a lip lift waiting until they're in their 50s or 60s, or is this something that people are doing younger now?
I'm seeing more younger patients as they realize that this is a surgical procedure that can give them a lifelong improvement in their lower face proportions, for sure.
I would love to hear a little bit about what the difference is between a lip lift, a lip flip, and then I understand the difference with lip fullness, but let's talk about how all of those can work together in harmony.
Yes, absolutely. So lip lift, already talked about a surgical procedure that will permanently shorten and change the proportions of the white and the pink lip, change the size of your lips. A lip flip is really, I think, poorly understood by a lot of patients. But in its very basic definition, a lip flip involves using a neuromodulator, so like Botox, Dysport, to target the orbicularis oris muscle of the mouth. So I always like to go into a little bit of anatomy. So there's a round muscle around our lips that acts as a sphincter. So it acts to pull the lips in and pucker them, and to some degree invert the lip like this.
Right.
So when we inject, and it has to be a very delicate amount, you can inject the neuromodulator right at the border of the pink lip and the white lip where that muscle is the most active. And it basically weakens the muscle to a certain degree and passively allows the lip to evert slightly. Each person will have a different response, different degree of response. Some people tend to hold a lot of tension in their mouth,
Right.
which means if we weaken that, they'll be most likely to release and kind of uncover that. That can also lead to some issues though, because if subconsciously they're used to holding that tension and then you take that away, they may feel really out of sorts. And I tell every patient that you may feel like you can't drink from a straw, or you can't pucker your lips, you can't whistle. My approach is very conservative, so I always start very, very low doses.
Yes.
So that's typically not a concern for many of my patients. But as that neuromodulator is kicking in, they just may feel a little off.
Right. It's
So-
like you've been clenching your hand, and then all of a
Correct.
sudden you can no longer
Correct.
clench or
That's
hold things in the
yes.
same way as
Yeah.
what you used to. So
Correct.
for anybody who's thinking about doing a lip flip, you'd recommend really starting as minimal as possible.
Correct.
This
Yes.
is not something to just dive in full
Correct.
force on.
Yes, because I've had people come to me from other providers, other places, and they said, "We'll never do that again," because I felt like I couldn't even drink from a cup for weeks,
Right.
and that just should never be the case,
Okay.
ever. Now, some people do that lip flip in conjunction with the lip filler
Yeah.
to really give them the maximum plumping effect, because again, the lip flip will allow your lip to roll out a little bit, and then that basically gives you additional opportunity to increase the volume of the lip with filler.
Okay.
Now, it does not change really significantly any proportions of the white lip to the pink lip. Compared to a lip lift, the surgical procedure, the injectable combinations are time limited, and also the degree of change is limited compared to a surgical lift.
Of course. And I imagine the recovery time is a little bit different for all three procedures.
Yes.
What does that look like for each one?
So for a lip lift, there's really not a significant recovery time other than having an incision initially very visible right under. Now we hide the incision in the natural shadows and creases between the face and the lip, and we all have them.
Yes.
But you'll still have sutures there, and we typically remove sutures anywhere from 4 to 6 days after surgery, sometimes 7, but it's kind of on that earlier side. After the sutures are removed, the incision will absolutely be pink and lumpy, and it'll typically take 2 to 4 weeks to kind of flatten. The biggest thing that I tell my patients about a lip lift recovery is that they will have a stiff lip for up to 3 months, which typically does not look deformed or anything like that. But again, we know our faces so intimately that every little thing we notice. So they will feel kind of stiff. They'll feel like their smile is a little different because if the lip is stiff, it doesn't move up. It doesn't have the space to move up as much. So a lot of people will feel like their smile is a little flatter and a little more artificial. And most people with appropriate education, they don't think twice about it. So that would be, I would say, very limited recovery, with the understanding that you will have some perceptible incision for a couple of weeks. Activity not significantly affected at all, physical activity. With injectable treatments, you'll have swelling, maybe some bruising, although it's a little rare if you're injecting in the right plane, for, I would say, 3 to 7 days.
Okay. What does it actually feel like doing these injectables or fillers? Is it painful or uncomfortable?
The lips are very sensitive. They're one of the most nerve-rich areas in the body. So without any intervention, it's very painful. What I do in my practice is I actually give everyone a dental block, which some people feel like is a little extreme because topical numbing is used a lot.
Yes.
For me, topical numbing just never works as well as I want it to, because my goal is for the patient to be not focused on pain or cringing and controlling their discomfort, but actually on kind of appreciating the final result and being able to participate in their own process along with me. For example, I always tell patients, okay, here's the halfway point. This is what we're achieving
Right.
in your lip. What do you think? So instead of them being distracted by pain and trying to seem like they're okay, I really want them to feel nothing, but just to see, what we're doing and be on board.
Yes. What are your thoughts as a plastic surgeon on the different lip, let's call it styles that we're seeing right now?
Yes.
I feel like it really ranges from somebody doing a very subtle amount that almost just slightly plumpens the lips, maybe has them looking more moist, to
Yes.
very blown out lips. Do you sort of follow the lead of the person who's coming in? What would you recommend to individuals who are just getting started with this?
To an extent, I really think that the face and your individual features will dictate what we can and cannot do.
Right.
In general, in my practice, I don't go beyond what I think your face or your facial proportions would allow. So if someone comes to me and they were born with thin lips and they want to have Scarlett Johansson lips, I mean, to some people, it just won't be possible no matter what we do, surgery or injectables. So I think it's my duty as their facial plastic surgeon to lay out expectations and make sure that we're staying natural. So for some people, what they want is really not achievable. For others, it varies from, do we want to, like you said, hydrate the lips? Do we want to improve the definition of their lips, which we can do, which we all lose with time and age? Do we want to improve symmetry? Do we want to improve balance between upper and lower lip? And those are all very reasonable goals. And for most people, they're achievable. I have to be very, very transparent about what we can and cannot achieve.
I think that's great. When most people come in and talk to you about their lips, what are some of the things that they're generally bringing up with you that they maybe don't love about their lips?
Yeah, usually it's asymmetry. So people don't like asymmetry. We all have it. We were all born with it. So most of the time we're addressing subtle asymmetries that they see when they look in the mirror. One side is a little lower. One peak of the Cupid's bow is a little sharper. And then as people start to age, they lose volume and they start to have kind of a deflated balloon appearance of the lips. Right. And this is where there's certain products that can give a really beautiful hydration without them looking done. Again, I don't want anyone to think they had their lips done. I just want them to look beautiful and healthy.
Right. What does the recovery process look like after doing something like lip filler?
Lip filler, not a significant amount of recovery. I advise that people don't have anything salty or spicy in the first 48 hours because the lips are very sensitive. They are swollen, just from the physical act of piercing them with the needle. And putting salt or spices on that surface will only bring more water in, increase more swelling.
Right.
Usually not anything. I mean, if they forget, it's not going to cause any permanent harm, but it might make them look kind of bee stung for a couple of days. I don't recommend ice. I don't like ice anywhere on the face.
Okay.
I mean,
what are your thoughts on all the ice rollers out there right now?
Well, that's not straight ice resting on the face.
Okay.
So I used one this morning.
Okay. So our ice rollers are okay. Yes. We're just not putting actual ice directly on our face.
Correct. Because it's not an actual frozen block of ice. It's just a way to administer cold therapy, constantly moving, right? We don't ever want to rest anything on delicate areas, especially right after, because they are very numb with my approach. So no ice, no spicy or salty foods. Expect to look swollen for, I usually say 3 to 5 days, but not a lot in terms of activity restrictions.
I'm hearing about some women dissolving their lip filler right now. And I'm curious, are you noticing any trends in regards to lip aesthetics? I know for a long time we were getting bigger and bigger and bigger. Is that shifting at all?
I think so. I think there's a lot more focus on kind of authentic, aesthetically appropriate treatment. It's not just bigger is better. I think obviously the celebrities are kind of setting this trend forward as well by dissolving their filler, which I think is kind of taken out of context as well. I think with more refined products now in the market that are more suited for the lips, for this anatomical area, I think looking back, a few years back, these products were not as refined as they are now.
Right.
So, in a lot of people, there's maybe too thick of a product was chosen because that was the only one available at the time. Maybe the techniques weren't as fine-tuned as they are now, with so many aesthetic providers being so motivated to be the best and learn. And so, there can be some long-lasting effects of filler that may have been perhaps not as elegantly administered, or maybe an improper product used that causes migration, that causes color changes of the lip, contour changes, kind of makes that border, that pretty border that we all subconsciously like so much between the pink lip and the white lip disappear and become bulky. When we start to see these things, it's definitely in the patient's best interest to dissolve, kind of get them back to baseline, and then potentially retreat with a new product with better fine-tuned techniques.
It's an interesting fact about lip filler is that you can reverse. If you don't love it, you can kind of go back to square one, whereas with some surgeries or treatments, that's not necessarily the case.
And I would say I always like to insert my own little experience, but it's not as easy as, we can just reverse everything.
Okay.
It's not as simple, because we do have our own hyaluronic acid in our tissues. And hyaluronidase, which is the dissolving agent for hyaluronic acid, doesn't discriminate because from our own endogenous hyaluronic acid to the artificial hyaluronic acid and filler. So sometimes it can cause volume loss where we don't want volume loss. Sometimes it doesn't, you need 3 to 5 sessions to dissolve, depending on the product, depending on the layers and the tissue planes it was administered in. So I actually always prepare my patients to say, we'll need at least 3 sessions. And then if we need less, that they're pleasantly surprised.
Right.
But
in order to get the lips to where you want to get them to, so you're moving slow and steady so that you don't have to go back in and dissolve.
Correct. I don't ever use the full, it's a special formula for each patient. But I typically don't flood people with hyaluronidase, because we certainly don't want to destroy their own architecture either. At the same time, we can't just say, every step that the previous injector took will be reversed with hyaluronidase. So again,
I love that you're clarifying that, so people aren't rushing out thinking, oh yeah, no problem, I can just reverse this and head back to normal. You want to make sure that you have a great doctor or practitioner. On that note, everybody is doing these injections lately. What are your recommendations for someone who's considering doing something with their lips in regards to finding a practitioner?
I would make sure I would go to someone that knows the facial anatomy intricately and intimately, and they see it in vivo for most days of their work.
Okay.
Meaning, for example, for me, I'm very comfortable with planes and thickness and how deep the needle should go, because I'm usually operating 3 days a week in the lips, in the face. I'm injecting local anesthetic. I'm going to deeper layers with surgery. So I have a very inherent understanding of tissue planes and thickness. I would definitely not go somewhere where the face wasn't the main focus, or they weren't addressing these areas with these procedures every single day of their career. Like if it's something on the side, I just personally would stay away from that.
I always think as well that it would be smart to find somebody who matches the aesthetics of what you're looking for, because by seeing them, you're going to see what they find beautiful. If they have a certain type of lip or a certain type of look, that is signifying to you where they might or may take you as well.
Correct.
Would you agree with that?
I definitely agree. Yes.
Okay. I have some Ask Me Anythings from our audience. Let's dive into those. I really like my lips, but they can look a little thin when they're not well hydrated. I just want them to appear full all the time, but nothing crazy. Would you recommend filler or a lip flip?
I would start with lip filler because a lip flip won't give you that hydration look.
Okay.
And I hear that a lot. And again, there's some really great products that are very thin, very similar to our own endogenous hyaluronic acid that can be injected to really just give almost like a better light reflection on the lips. So I would start there, and I would also evaluate how much do we think that their thinness can be improved with relaxing that muscle.
Right.
You know, to some people, I think it may not at all. So as long as it's an appropriate candidate, I would start with filler and potentially incorporate a lip flip if their anatomy allows for it.
Okay. I've seen videos on social media where people with lip filler can't drink through a straw. Is that a myth?
It's not a myth. It just should never happen.
Oh, okay.
With appropriate dosing.
What has happened when they're no longer able to drink through a straw?
That means that the dosing that was injected into the orbicularis oris muscle that gives the mouth its sphincter function was overdone.
Too much.
So that there's now a loss of function, which should never come from aesthetic treatments.
Okay.
Function is always number one. Aesthetics is always second.
With the lip flip, when you're using a neuromodulator, does that eventually wear off, or is it permanent?
It wears off because neuromodulator has a time limit. I would say in general, we tell patients neuromodulator can last for 3 to 4 months. Everywhere else in the face. Now with the lips, it's such a tiny fraction of what we typically use in other muscle groups in the face that I would actually say 1 to 2 months for this area.
Okay.
Especially with my conservative dosing.
Yeah. I'm going in for a consultation to get filler. What should I ask for to make sure I get natural results?
I would ask, well, you brought up a good point, Erin, earlier, is take a look at the office and make sure that everyone in the office looks the way that your aesthetic eye perceives it to be a good result. And I would make sure that you can feel comfortable with the injector, kind of see some of their work before and afters, ask their approach, and ask about their experience with complications, because no treatment is risk-free. So you always want to be in a place that's fully prepared to treat any complication that can arise from injectables.
Okay. I want to dissolve my lip filler, but I've heard it can be pretty painful. What's that process actually like, and is it worth it?
It's definitely painful, but it doesn't have to be. Okay. So with appropriate anesthetic, whether it's topical or a local nerve block, like I like to do, it doesn't have to be painful at all. It does involve injecting a dissolving agent into the lips in a similar fashion that the lip filler was injected in. Right. But it does not have to be painful. And I do think it's worth it if the anatomy is distorted. Okay. It needs to be refined.
Amazing. I have lip filler and have also done lip blushing. Can I still get a lip lift?
Yes. Lip blushing typically is a very natural kind of a staining technique designed to enhance the color of the lip. It only should involve the pink lip. So with the lip lift, we are causing a little bit more of the eversion of the pink lip, which should not be affected by the stain. Lip filler sometimes can affect the surgical technique of a lip lift, depending on whether the lip filler has migrated, depending on whether it's distorting the normal architecture of the lip. And in those cases, typically mindful dissolving can kind of remove that as a factor, and the lip lift can still proceed. But in most cases, if the lip filler previously was done in congruence with natural anatomy and it's not affecting any of our tissue planes, then we can proceed with the lip lift as planned.
I'm considering a lip lift. Would a lip flip give me an idea of what it would look like before I try a more invasive option?
I think a lip flip is a reasonable way to test out what an everted lip may look like,
Yes.
with the mindset of it would probably be limited duration, limited degree of eversion. And in some patients, of course, it may or may not even make a significant difference. It all depends on the muscle contractility and its effect on the lip position.
Amazing. Is there anyone who would not be a good candidate for work around the lip area?
Some patients, yes. Some patients with very thin lips that don't necessarily, that were genetically have thin lips, may not, there may not be enough real estate to put filler in to plump it.
Yeah.
And they also may not be a candidate for even a surgical lip lift because they may not have enough surface area to even evert, if that makes sense.
Yes.
The other thing I always look at is your maxillary incisor show with the mouth and lips slightly open.
Yeah.
So if someone already has a lot of tooth show, you don't want to pull their lip up even higher.
Right.
And
Okay.
there are some special techniques within the lip lift itself that can enhance or limit the amount of tooth show, but regardless, there will always be some increase in tooth show with the surgical lip lift. And you have to be very mindful of that. You don't want to have
Go too
people
far.
show their teeth at rest.
Right.
But there might be some other alternatives like lip augmentation with SMAS or kind of their own connective tissue that can be an option for a little plumping without elevating that lip.
Have you ever heard of somebody doing a fat transfer into the lips?
I have.
You have?
And I'm not a fan. I don't think fat belongs in the lips. It doesn't.
It's
Fat
not
doesn't
there
exist.
naturally.
So yes, I think it tends to give it a really boggy, swollen, permanently swollen appearance. Now I'll kind of expand on that. Nano fat, which is a way to process harvested fat to remove cellular components and only leave behind really beneficial skin regenerative factors like cytokines, stem cells, growth factors. Nanofat can be injected into the white lip for wrinkles, for
Lip lines.
yes, lip lines, wrinkles, skin tone that's unfavorable, but that's not a volumizing procedure. That's a skin regenerative, skin enhancing procedure.
Okay. I feel like I learned so much in this conversation. I really appreciate you taking the time to be here.
My pleasure. I loved it.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.